Hello, welcome to another episode of Medical Files brought to you by Studio77, where your health is our priority. I am Ade-Adeleke Favour Eewajesu, VP always on duty. Now we're taking a closer look at a condition that affects many women, but only few understand. And what is this condition? It's known as the Polycystic Ovary Syndrome, PCOS. Now imagine struggling with painful acne, irregular periods, facial hair growth, weight gain, and even fertility problems all at the same time. This is the reality for millions of women silently battling PCOS every day. And so now let's get into it directly. What is PCOS? PCOS is a hormonal disorder that affects women, especially those of reproductive age. And it happens when the ovaries produce too much of the male hormone called androgens. Now this hormone imbalance causes problems with ovulation and can lead to the development of small fluid-filled sacs called cysts on the ovaries. But here is the thing, not every woman with PCOS has cysts, and not every woman with cysts has PCOS. PCOS and cysts are two different things. That's why it can be confusing and hard to diagnose. Now, what are the symptoms you shouldn't ignore when it comes to PCOS? Let me break down some of the common signs of PCOS for you. They include irregular periods or no periods at all. Another one is heavy bleeding during menstruation, excess hair growth, especially on the face and on the chest and the back. Another one is weight gain, especially around the belly. Another symptom is hair thinning or hair loss. Another one is difficulty getting pregnant. Some women may have only one or two of these symptoms, while others experience several. Now, what causes PCOS? The exact cause of PCOS is not yet known, but doctors believe it's linked to insulin resistance when the body doesn't respond properly to insulin. And you know, we said the last time when we were talking about diabetes that insulin helps to regulate the blood sugar level. Now, when insulin is produced and the body cannot respond to it well, it can lead to PCOS. Another one is hormonal imbalance. When the hormones are not balanced, when they do things they are not meant to do and they appear at times they are not meant to appear. Another one is genetic. If a mother has PCOS, the child will most likely have PCOS. Insulin resistance can lead to high level of insulin levels, which may cause the ovaries to produce more androgens, worsening the symptoms. So it's the production of androgens that worsen the symptoms of PCOS. Now, so why is PCOS a big deal? PCOS doesn't just affect your monthly cycle. If left untreated, it can lead to serious health problems like diabetes, especially type 2 diabetes. It can lead to heart disease, it can lead to heart failure, it can lead to sleep problems, depression and anxiety. And even women that suffer from PCOS, they tend to have poor self-esteem due to the changes in their appearance. So, how is PCOS diagnosed? There is actually no single test for the diagnosis of PCOS, but diagnosis may be based on blood tests to check hormone levels, ultrasound to look at the ovary, a physical examination, or a medical history or symptoms. Doctors usually diagnose PCOS based on at least two of the following. One, which is excessive androgens, presence of polycystic ovaries, and irregular periods. So now, can PCOS be treated? There is actually no cure for PCOS, but it can be managed effectively, and lifestyle changes are the first step. Lifestyle changes such as eating healthy, you consume foods low in sugar and high in fiber, exercising regularly, which helps to increase insulin sensitivity and reduce symptoms. Another one is weight loss. A 5 to 10% weight loss can also help. And also medications can be prescribed to regulate periods, to reduce acne and hair loss, also to improve fertility. So now, before we close, let's do a quick rundown on some of the things we've talked about. You know that PCOS is a condition that affects women and that it has a lot of symptoms, which includes irregular periods or no periods at all, heavy menstruation, excessive hair growth on face, on the chest, on the backs, even acne, painful acne. We also talk about hair thinning and hair loss. Then we move further to talk about the diagnosis, which talks about that there is really no test for diagnosis, but the doctors can go to a physical examination. They can also do they can make use of a medical history or symptoms. They may also do ultrasound to check on the ovaries. They can do blood tests to check on the hormone levels. Then we talk about how it can be treated. The treatment is not, there's really no cure, but it can be managed. We talk about change in lifestyle, such as eating healthy, consuming food low in sugar and high in fiber. We also talked about exercising regularly, which helps to improve insulin sensitivity and reduce symptoms. We also talk about weight loss. If a person is obese, the person can do well to come down about 5 to 10% loss in weight can help. I will talk about medications that can be prescribed for regulating periods, reducing the acne and hair loss or hair growth, and also we talked about medications that can improve fertility. In conclusion, PCOS can be overwhelming, but with the right knowledge and support, it can be well managed. So if you are a woman experiencing one or two of these symptoms, do not suffer in silence. Go to a doctor, seek medical help. If you know someone diagnosed with PCOS, you can do well to support them, talk to them, and make them know that they are not alone and help is available. And with this, we've come to the end of today's episode of Medical Files, brought to you by Studio77. I remain beauty always on duty. Join me again next week, same time, same platform, as we bring you another episode of Medical Files. Till then, do not forget to take care of your health, because that's the only body you've got. Bye.